So many people ask me, what is periodontal disease? What is gum disease? Well, gum disease is bleeding and inflammation in the gum line that starts to affect the bone, and you have bone loss. Bone is what holds the teeth in place to keep them stable. And when there's bone loss, that's when our teeth can become loose. So in my practice, what we do really is talk about how bleeding isn't healthy. If you have a cut on your thumb and it kept bleeding, that's not healthy. We need to address it. So what we do in our office is we do some bacterial testing. It's called oral DNA testing. And what we do is we actually culture the bacteria in your saliva to see if you need any additional help after you have your gums cleaned. For example, if you went to the doctor, they would culture your throat to see if you had strep before they would just give you an antibiotic. We're not just going to randomly give you something without knowing exactly what's causing it. So we go a step above and beyond in my practice by actually doing oral DNA tests to just help us adjunctively treat you in the best way that we can. When you have bleeding, it's really important that we get rid of that bleeding, because what happens is we have inflammation then in the rest of our body. So inflammation in your mouth is inflammation everywhere else, and we know how detrimental inflammation is in our body and how it affects so many parts of our life in terms of our health. So what we want to do is stop the inflammation in your mouth by doing what's called periodontal therapies, where we actually irrigate the bacteria that's underneath your gum line. You can't reach underneath your gum line. So while you might brush and floss, you're not able to go underneath that gum line, which is where the bacteria and inflammation sits. So in my practice, what we do is we're going to educate you, we're going to have you get a water pick, a certain medication and rinse that you use, and we're going to make sure that you keep your gums and bone very healthy. You'll also see that the tissue becomes really nice and pink versus your gum tissue being red all the time. Red's not healthy. We want pink, plump, vibrant tissue, and that's what happens after you take care of the gum disease.